Who's a newer patient here to Finn Chiropractic, and we're going to talk a little bit about Jim's success and his results that he's had with Shockwave. So Jim, what was going on with you had knee pain, right? Some problems with your knee.
I had knee replacement.
Okay.
So when you're doing therapy, you know, they want you to get a certain amount of bend and a certain amount of flex in a certain amount of time. So I had been out about 10 weeks and I was stuck at 104 degrees of bend on my knee. So I was getting frustrated. My doctor said, hey, we're going to have to do MUA, manipulation under anesthetic or anesthesia.
Right, which is a pretty intense procedure.
Yes.
Right, it's very intense.
And I'm done with the anesthesia. It makes you stupid.
Yes,
you know,
I agree. We don't like that either.
Yeah, so, you know, I wanted to avoid that, and I told the doctor that. And of course, he was wanting to do it. And I'm like, okay, I'd already heard about you guys having the shock treatment.
Yeah.
And from my PT at the doctor's PT, of all places, right?
Interesting.
So I figured I'd give it a shot.
Yes. Right.
And it's still like right in this area up here. And
Well,
then
I
on the
think he's
side.
doing like the horseshoe thing.
Gotcha.
Right.
Of course. Starting to pop first.
You're headed, dude. Really south.
That we have here. So
deal.
my suggestion would be start rubbing that on that knee once or twice a day, and that's going to also help to improve some circulatory response. How many sessions have you had so far?
Well, I have two, but after the first one,
we
had 11 degrees increase in bend. We were stuck at 104 for 6 weeks, and then after that, we got up to 115, which was the minimum to avoid MUA.
How did that make you feel?
Pretty happy.
Right?
Yeah,
Encouraging too,
yes,
right?
very much so. I was getting,
so cool.
you know, a little bit downtrodden, a little bit, I don't want to say depressed, but I was like, man, I'm struggling, I'm trying, I'm doing everything I can do, and it's not working.
Yes.
So, you know, after doing it, I was pretty excited. I was calling everybody and telling them, you know.
I think that's awesome. So that's radial pressure wave therapy, right? It's shockwave therapy, right?
Yes.
So it goes into those tissues, breaks up that scar tissue, all that junk in through there before it becomes permanent.
Right.
So we've got a plus 11 degrees as of right now.
Yes.
We're going to do our best to get a little bit more, right?
Yes.
We would love to.
Well, actually, it's plus 12 because I had therapy yesterday and we went up 1 more degree.
Keep it going, baby. Right? We're
That's
just gonna
right.
keep